रिकॉर्डिंग पे डाला आपने? हाँ रिकॉर्ड किया यूट्यूब पे माइक म्यूट करो सर ये इधर हमारी नहीं क्यों यहाँ पे Good morning, sir. Hello,
Hello, good morning.
Good morning, sir.
Hi, Rajni, how are you?
I'm good, sir. How are you?
Quite good. Nice to see you after a long time.
Yes, yes. We thought until we are able to meet in person, let us at least meet like this.
Sure,
virtually.
sure. Yes, yes.
Sir, thank you very much. You look still great. A lot of energy and very fresh.
Thank you.
Thank you very much for joining, sir.
Yeah.
So I'll just ask Amreen, has everybody else come in? Hello?
Yes, ma'am. The students have joined now.
The students have joined. Okay. So before we start, I'd like you to tell you that even Bela Agarwal is here. So you remember Bela?
Sure, definitely. Yes.
So
good morning, sir.
Morning, Bella. How are you?
I'm good, sir. Such a see you again.
I'm seeing you after a very, very long time.
Yes, sir. We last met at the SIPCON conference.
Correct. Exactly. Exactly. It's almost
Yes.
3 years now. Yeah.
Yes, sir. Yes, sir.
Right.
So hope all's fine.
Yeah, yeah. How about you?
All good, sir. All good.
Good. Good to hear that.
Yes, sir.
All right. So shall we begin today's session?
Please do.
So let us begin today's Gurudiksha session with our Guru, and whom we are so happy to see here amongst us, Dr. Vikas Rajyathyaksha, who was our teacher at St. G.S. Medical College and Physiotherapy Department way back in 89 when we joined. We graduated in 92, and those were our formative years, which sir has contributed hugely, leaving his impeccable impressions on what we are today. So we owe it all to you, sir. Thank you so much. And it is such a joy that he has agreed to interact with the next generation of our budding physiotherapists at MGM Institute of Health Sciences at the School of Physiotherapy. So on behalf of the entire team of faculty members and students of MGM School of Physiotherapy, I welcome you, sir. It's a great honor and privilege to have you with us today morning. Another thing that I would also impress upon all of you is that sir has traveled wide and far within the country and across the globe in physiotherapy education and practice, and so would be able to give us a much wider and larger picture and even a deeper picture of how physiotherapy has evolved over the few years. as a professional and also as a father of a daughter who is now a physiotherapist. So I think this perspective is very, very rare in the profession. So having the dimension of an established, renowned physiotherapy educator and practitioner in the country, and then having the wider perspective of physiotherapy education and practice across the globe. And now, as a not only as a mentor of physiotherapists, but also a mentor of a daughter who's a physiotherapist. So I think with this exclusive perspective, we welcome Dr. Vikas Rajadhyaksha today amidst us to interact with our students. And it's truly an honor and privilege to have you, sir, with us. So thank you ever so much. And we will look forward to an opportunity to welcoming you in person on the campus of MGM School of Physiotherapy at MGM Institute of Health Sciences. So with this welcome, I now request Dr. Bela Agarwal, Professor and Head of Cardiopulmonary Physiotherapy at our school, to introduce Dr. Vikas Rajadhyaksha. So Bela, over to you.
Yes. Thank you, Dr. Rajni. And it is my utmost pleasure to introduce Dr. Vikas Rajadhyaksha to our budding students. So Dr. Vikas Rajadhyaksha has been a renowned physiotherapist with an experience of over 44 years in the field of physiotherapy. His academic career has been wide and vast, and he has worked in India as well as countries such as Oman. He has been an associate professor in charge of the St. GS Medical College Physiotherapy Center for over 3 years, and he has headed the Department of School of Physiotherapy at St. GS Medical. He has been a group leader for coordinating physiotherapy activities at the United Leeds Metropolitan Hospital in UK, and as a senior teacher in physiotherapy at the Institute of Health Sciences for over 4 years. He has worked as a rehabilitation consultant at Al Masara Hospital, Ministry of Health, Oman. Sir has co-authored a book on the management and of painful and musculoskeletal conditions for the Boots Pharmaceuticals Limited. In spite of his academic career, he has been a very active sports physician and worked as an honorary physiotherapist at the Sports Medicine Center at KEM Hospital. Also has been actively involved in the Bombay Cricket Association and in the World Cup of Hockey held at Bombay. He has been the official physiotherapist at the Commonwealth Games held in Bombay right in the early ages of 1982, where sports physiotherapy was slowly gaining attention. Sir has also been the physiotherapist at the international meet at Bombay and several such events through his career. Sir has been an active researcher and has presented several papers in several conferences and co-authored books as well as research papers. Without much ado, now I would like to invite Sir to talk and address the students of MGM School of Physiotherapy. Welcome, Sir, and over to you. Thank you.
Yeah, just one more word to the students before we have Sir speaking about himself. What I would like to also emphasize upon this generation is how Sir has lived with his own vision of fitness as an ambassador of physiotherapy. So we were, Sir, just a few days ago, we had the National Assessment and Accreditation Council peer team visiting us, and they were trying to impress upon the students how physiotherapists have to be fit themselves to be able to be very effective ambassadors of physical activity in sports and fitness. And I think Sir has lived this not only through his practice, but as you see him today on the screen, and you will very soon experience that when we have the privilege of having him over on the campus, that he has practiced it himself and therefore is at most in a position to be able to guide our students on what it is. So thank you once again, Sir. We are so happy to see you today and sparing your time and effort to be able to connect to this generation, to know what physiotherapy was and how did your generation bring it to what it is today? Because today we have it all on the platter thanks to all the efforts that you have invested in the past. So over to you, sir, to describe the journey. Thank you.
Thank you, Rajni. Thank you, Bela, for your quite flattering introduction. I appreciate that. And without wasting much time, I'd like to start my journey in this noble and very enhancing field of physiotherapy and enriching field of physiotherapy. I started my physiotherapy journey in 1976 after I finished my inter-science B group. That time it was inter-science and not 10 plus 2 plus 3 system. So at our time, the physiotherapy profession, physiotherapy undergraduate course was only for 2 years. And I would say the life was much easy, life was fun. The first year we had anatomy, physiology, exercise therapy, and electrotherapy as the university subjects. And we had pathology and psychology as the internal subjects. That means we had to pass these two subjects at the college level, and then only we were allowed to appear for the first year university exam of the BSc program. Now, before I started my journey in physiotherapy, I had little exposure to physiotherapy at my residence itself. My mom was unfortunately a heavily diabetic person. I'm talking about time period of 1970, 1974, somewhere there. And unfortunately, she had developed diabetic neuropathy. And that is the time when I got introduced to one of my senior physiotherapy colleague, Shrikant Kamath, who had come over to our place to assess my mom, and I could see how a physiotherapist was doing his job. Of course, that was in 1974 or so. And later on, what happened was my brother, who is a psychiatrist now, he had told me that physiotherapy is an upcoming profession. And see if you are,
सब
interested.
साथ में हो रहा है आज मेरे साथ.
Can I continue?
जल्दी जाना है.
I really please mute your mic. It's a for all participants to kindly pay attention to your mics and keep them on mute.
Can I continue?
Sure, sir. Sorry for this.
No, that's okay. That's okay. So in 1976, I joined physiotherapy. And again, there was a small episode to it. I was actually waitlisted. I was fourth on the waitlisted candidates for physiotherapy. And I joined physiotherapy about a week or 10 days late. So I missed the initial so-called ragging issues which were there. Of course, they were very minor ones, but I heard the stories later on. So as I was telling that it was only 2-year course. And in first year, we had this pathology and psychology as our college exams, college subjects. And then anatomy, physiology, and exercise therapy, electrotherapy. These were the only 4 subjects. But the electrotherapy included what we later on came to know as medical electronics, while the exercise therapy also had a component of biomechanics in it. We had excellent teachers to teach exercise therapy, which was none other than Miss Dastur and Mrs. Irani. Mrs. Irani also taught us massage in a very scientific way. For electrotherapy, we had Miss Kapadia and Miss Usha Jaising. And as such, I liked electrotherapy very much. And I started taking keen interest in electrotherapy right from my first year. Second year consisted of medicine, surgery, physiotherapy in medical conditions, and physiotherapy in surgical conditions. Again, 4 subjects. And the teachers, what we got for teaching medicine and surgery were out of the world. We had Dr. Samsi, who is to teach us general surgery, Dr. G.B. Parulkar, who became the dean of KEM later on, he taught us cardiothoracic surgery. Then Dr. Tilway is to teach us medicine. And of course, there were other heads of other departments which to chip in for our medicine surgery lectures. Now, all throughout our second year, there was a lot of self-learning. Of course, there was a huge component put in by our clinical physiotherapist at KEM, in orthopedic center opposite Tata, in KEM hospital itself, as well as the physios in the CVTC, which is cardiovascular thoracic center opposite KEM. All were excellent teachers. These were the clinical teachers, and we had the excellent faculty at the orthopedic center in physiotherapy school. So at all the time, we were made to think on clinical reasoning. What is considered today as a big topic, this was ingrained into us at that level. So at no time we were given a kind of a physiotherapy program on platter. We were always made to think that what you would do in this given situation. Don't just follow me what I am doing. Try to do the best for your patient. Now, when we finished our undergraduate program, somewhere in, I think, July 1978, that time there was a concept of junior demonstratorship. It was a 6 months kind of internship, so to say, in today's world, today's nomenclature. And I was selected for that, and the selection was based on the merit. So first 10 students in the graduation program would be offered this post of junior demonstratorship. And I was always looking forward to taking up that. Now, around same time, we had heard the news that the then Bombay University, now Mumbai University, was going to introduce master's program in physiotherapy, the first ever in India. So I had keen interest in it because my family as such has a teaching background. All my parents as well as my siblings, they were all have been teachers at some time or the other. So I had that kind of a urge in my blood that I should also go for teaching. And I thought MSc in physiotherapy would be a good stepping stone for pursuing my teaching career in physiotherapy. But there was still no confirmed news. So I completed my junior demonstratorship. At the same time, I also got a locum post in Sushrusha Hospital. So it gave me a kind of a parallel view how work is done in a municipal run hospital and how a work done in a private hospital. So that gave me a lot of exposure how to deal with the patients in general. Just one thing I would like to share before that this junior demonstrator post, it started somewhere in October. So there was a gap of about 2 to 3 months. And I came to know that there was a kind of a observership available in Jaslok Hospital. So I applied there and I joined there as a trainee physiotherapist. Now that was a kind of a new post what they had started. And I worked there for 2 months or so. And that is the time I got exposure to probably what I was going to do later on as my Gulf exposure. Because there were a lot of patients who were coming from Gulf. And I learned little basic Arabic in those 2 months. So as I was continuing with this trainee physiotherapy post, I came to know that fine, Bombay University has taken a decision and they are going to start the physiotherapy program from November 1978. And that is the time I decided I don't want to continue in private practice. I don't want to be in a private hospital, and I want to come back to KM. And that is where I resigned from that trainee physiotherapist post and joined KM again as the junior demonstrator. Now, again, after seeing my interest in electrotherapy, Ms. Kapadia gave me the responsibility of conducting the electrotherapy practicals, which I really enjoyed, and I continued to teach electrotherapy later on as well. After completing my junior demonstratorship, there was no job available, and since I was a full-time MSc program student, I was not allowed to take job anywhere outside of KM. So that was a time when there was a sudden shortage of clinical physiotherapists in orthopedic center of KM hospital. And then Ms. Dastur told us, she ordered us that there is a shortage of physiotherapists in clinical physiotherapists in this, and there are no interviews will be conducted in short time. So I would like you to go and help the existing clinical therapists. And it was a really God-sent opportunity for me to develop my physiotherapy skills in field of orthopedics, now what is known as musculoskeletal physiotherapy. I had again an excellent guidance from 2-3 senior physiotherapists who were working there at that time, and I would like to name a few. One was Miss Praveena Shah. The other one was Miss Indu Vora, and they were the ones who were kind of taskmasters. And one more was Miss Vaijayanti Pai. So these three were the taskmasters, and they meant physiotherapy as a business. And this exposure with these three senior physios honed my skills in musculoskeletal physiotherapy. Later on, what happened was somewhere around month of June, July 79, there were part-time physiotherapy posts were advertised for the KM campus. And at that time, I thought I should have also exposure not only in orthopedics, but in general medicine, general surgery, etc. So I appeared for the interview and I got selected for the part-time physiotherapist posts. And I joined KM somewhere, as I mentioned, somewhere in July or August of 1979. And then I was going to get a biggest shock of my life. As soon as I entered the KM physiotherapy department, which was situated on the second floor of the KM hospital, I think there were 2-3 others who were with me, also had joined on the same date. And the physiotherapy head at that time, I think she was Miss Yasmin, and later on Miss Netra Karnik took over. So Miss Yasmin told me that, see, because there is no physiotherapist right now in CBTC, and I would like you to go and take over the job over there. I said, Yasmin, I just come from orthopedics. All the time I worked in outpatient department and in orthopedic ward. What I will go and do there? So she said, don't worry, because Netra is in charge of CVTC. She will help you out, and you go and talk to her. She will tell you what to do. I said, fine, ma'am. And I went to CVTC just across KM. And there, Netra tells me that you are going to work in cardiothoracic surgery and Department of Chest Medicine. Now, the cardiothoracic department was headed by that time Dr. J.B. Parulkar, and the chest medicine was headed by Dr. S.R. Kamath. Now, both were the giants in their field, and I really didn't know what I was going to do there. But with Netra's guidance and assistance, and of course, I was received with open arms by Dr. Parulkar as well as Dr. Kamath, and they took care of me, they advised me, they guided me all throughout my stint there for an year or so. And that's the time I learned a lot in pulmonary medicine, pulmonary rehab, etc. Same time around, I got an opportunity to join the Sports Medicine Center. Now, Sports Medicine Center was being run at that time on the ground floor of CVTC Center, and it was a OPD based program which was run every Saturday 9 to 11, and it was open to any sportsman anywhere from India, free of cost. The only thing what the patient required to do was make a case paper of 2 rupees. That's all. And all the consultation, all the treatments, everything was done free of cost. So this is the time I got exposure to sports medicine, and for which I am grateful to Dr. Arun Samsi, the professor and head of surgery at that time. Also, Professor Dr. Ravi Bapat, who used to be there, and Dr. R.S. Dheer, who was the professor and head of orthopedics at KE. So these three helped me to upgrade my clinical diagnosis skills. So all these three encouraged me to diagnose, do the differential diagnosis, do the clinical diagnosis on my own. And this helped me immensely when we used to go on-field activities. We used to get invited to give medical cover for various sports events all over Mumbai, I would say, and in suburbs of Mumbai. So this is the time when sometimes the bosses were not available. We were required to give first aid. We were required to do the clinical diagnosis and take immediate steps to help the athletes, cricketers, whoever the person needed our assistance. So I am extremely grateful for these three doctors who helped me to come to the level to which I am there today. So as we started our master's program, it was a new program altogether. And we had 4 postgraduate teachers, 2 from KEM and 2 from All India Institute of Rehabilitation, Haji Ali. So our 2 teachers were Professor Shahani and Professor Ms. Dastur. And from All India Institute, there were Professor Chainani and Professor Mokashi. So we used to have 2 lectures, 2 lectures a week, one at KM and one at rehab. And that is the time at All India Institute, we got exposed to the artificial limb fitting center, as well as the rehabilitation of chronically differently abled persons. Now, before I go into that, I will like to pull you back a little bit into history. In the second year of physiotherapy, our undergraduate program, we used to have educational visits to various places of interest in and around KM. So one of them was Ackworth Leprosy Hospital, which was situated then in Vadala. Now, leprosy was very rampant during those days, and used to see them quite often in society as well. So we used to go and have a look at those patients. We used to have a placement in Ackworth Leprosy Hospital, where we used to interact with the patients. We used to interact with the consultants there and learn what physiotherapy could do for the unfortunate situation of leprosy patients. Now, mind you, in those days, leprosy was not, a person affected by leprosy was not quite welcome in our society. And there was a stigma of being contagious, highly contagious, which was not actually true, but that was the notion in the society at that time. So we used to counsel those patients. We used to make them understand that no, you are not a stigma on the society, but you also can be a part of society where you can learn some new professions, new occupations, and come back to the society. Then we also had a visit to the artificial limb fitting center and the paraplegic home, which is run by the our Army Defense Forces, which is situated in Pimpri. The paraplegic home is situated in Pimpri near Pune, and the artificial limb fitting center is situated in Vanavri area, again in Pune. Again, this was an eye-opening experience to all of us, where we could see that what a paraplegic could do if he or she is rehabilitated well, and if all the facilities are made available to them. So hats off to our defense forces, where you could see that our dear army men who could go back to different professions after getting full rehabilitation from this center. Fine. So I come back to our MSc program. This program being new, it was very innovative for us. What we used to do is we used to have postings in different departments of KEM, as well as in All India Institute in our morning sessions. So that is the time we used to do little bit of clinical and then go and sit with the various consultants in their OPDs. Now this again helped us to get us our differential diagnosis and clinical reasoning. And there I must mention again Dr. Shekhar Bhojraj, Dr. Nicholas Antau, Dr. Shyam Mukhi, Dr. Ashit Rao from the orthopedics, then Dr. Ashok Mahashur from chest medicine, then Dr. Tendulkar from cardiothoracic surgery, and so many and so more. Can't finish the list. They enlarged our physiotherapy horizon and gave us so much input that it's very important that how you deal with your patient, how you talk to the patient, how you assess the patient, everything makes a big difference. And at one time, they made us realize there are no shortcuts in medicine. Even though your gut feeling is telling you something, you must do A to Z procedures, no shortcomings there. Because sometimes you can miss something in your enthusiasm, and for which you may or your patient may have to pay heavy price later on. So no shortcuts anytime in our practice. Even today I follow that. I don't take any shortcuts. I do follow steps from A to Z before I come to my treatment program. So once I had finished my post-graduation, I got an opportunity to join the full-time clinical service of KEM Hospital in the orthopedic center. And I was lucky to work with Dr. Bowdekar, Dr. Ellen Vora, and as well as few others who again helped us to enlarge our field of orthopedics. Now, some of the rounds which we used to attend were sometimes very funny, sometimes very, what you can say, very probing ones, because physiotherapist was always required to attend the rounds, and physiotherapist was always on the firing range, because as far as muscle charting is concerned, as far as range of motion is concerned, rehabilitation, mobilization, and the physiotherapist was answerable. So anything to that, all the faces will turn to physiotherapist, and you need to be updated with whatever is happening with the patient on that day. So I continued as the clinical physiotherapist for about 2 years or so. And then in March 1982, I got opportunity to apply for the lecturer's post in physiotherapy. And there were about 4 or 5 candidates, and there were 2 posts. I probably, with my qualification and experience by that time, I got selected for the post of lecturer. And that is where my actual teaching as such started from that time. As I mentioned earlier, orthopedics and electrotherapy was my forte. So I was given the task of teaching these 2 subjects to the undergraduate students. And in addition to that, I was also given the responsibility of departmental library. Now, physiotherapy department had a library, a small collection, which was in addition to the huge library resources of KEM Hospital. So the idea was that so that our students need not go all the way to the KEM library. We had a small area where we could accommodate about 8 to 10 students who could sit there and read, as well as who could borrow books on regular basis. The books we used to keep ordering every year, and the source for these books used to be mainly from Professor Shani. As some of you may be aware, Professor Shani used to go all around the world. He was more of electrophysiologist rather than physiotherapist. So he was the pioneer starting EMG in India, electromyography and nerve conduction studies. He was the one who started in India. And we had a Everest Chemical Institute just behind the orthopedic center, where we had a full-fledged electrophysiology laboratory, and where we used to conduct EMG and nerve conduction studies then. So Professor Shani used to go all over the world, meet all over the scientists and the physiologists and the electrophysiologists, and from there he used to get the idea of what new has been added in the field of electrophysiology, and he used to percolate that knowledge to us. Later on, we continued with our teaching, and then I got an opportunity to spend 1 year at Kuwait University. One of my colleagues who had gone to Kuwait University as a faculty, that person informed me that there is a vacancy. Would I like to join them? So I always wanted to explore the world. So I said, it's a God sent opportunity to me. Why not? And I applied for that post, and I got selected as a lecturer in the Kuwait University. That was year 1989-90. So I applied for a sabbatical leave, which was not a very common thing in those days in the field of physiotherapy, because of various tedious municipal service regulation rules. But the then Dean and with assistance of Professor Shani, the Dean was Dr. C.K. Deshpande, and our head was Professor Shani. So with their assistance, I did manage to get 1 year sabbatical leave, and I went to Kuwait to join there as a faculty. So again, this helped me a lot to get the international exposure, because Kuwait University had international faculty. So there were teachers from New Zealand, France, Sri Lanka, Nigeria, Canada, and Britain, of course. So we had an excellent team where we could impart physiotherapy knowledge and skills to our students. That's the place where I started upgrading my physiotherapy knowledge. And we were fortunate enough to do our Mackenzie Part 1 course at Kuwait University. So that gave me the insight for the non-conventional physiotherapy, I would say, so to say, in those years. In those years, physiotherapy was only exercise therapy, electrotherapy, and massage, nothing else, not much. But this is the time the mobilizations, manipulations, and other types of physiotherapy skills were slowly being introduced to the physiotherapy students. So that's what I learned there, that there is something more than conventional physiotherapy. Later on, by July 1990, I was back after completing my 1-year stint at Kuwait University. And then the invasion of Kuwait happened. Iraq invaded Kuwait, and then there was a disaster for almost next 2 years. Once the things stabilized, they approached me once again, wanted me to join, but by that time I was happy with my position at KM. I was already promoted as assistant professor, and I was continuing my duties, teaching duties, as well as now I was given the additional responsibility of budget preparation. So the equipments what we needed for the physiotherapy department, the various electrotherapy, exercise therapy equipment, or any other resources, that responsibility was given to me. And I was enjoying all these challenges which were thrown at me. So I did not go back to Kuwait, and I continue working at KM. But in somewhere in June 1992, I saw one advertisement in Times of India asking for teaching faculty for Sultanate of Oman and teaching faculty positions in city of Muscat at the Institute of Health Sciences. I thought, why not apply and see where I stand in this world of competition. So a month went, 2 months went, 3 months went, nothing happened. So I just forgot about it. And one day I got a registered letter saying that I was called for an interview in the uh, uh, Ministry of Health, called me for an interview in the Oman embassy at Nariman Point. And they told me come with my original certificates for the interview. And there I met the then head of physiotherapy department and one of the Ministry of Health officials who interviewed me and offered me a post. Now here I would like to emphasize that the salary what they offered me was not up to my expectation. And I was not in a hurry to leave KM because I was extremely happy at that time. So I told them that what you are advertised and what you are offering me is not what is expected of with my qualifications experience. So I'm sorry, I won't be able to accept it. Then both the representatives, they looked at each other and said, okay, would you mind waiting outside for some time? So I said, I don't mind. And then they called me after half an hour and they told me, okay, we will be happy to give you little higher compensation. Would you accept it? I had a look at it and I still not satisfied. I said, sorry, gentlemen, I'm not interested in this. And if at all, I should be getting what is due to me. And then again, they looked at me and asked me to wait outside. And ultimately, they agreed to what I was asking for. So what I'm trying to say, if you are convinced of your education, of your experience, feel free to demand what you deserve. That is most important for you as a profession. The jobs will come, jobs will go, but you should be satisfied. You should be happy with what you are doing. So when I got this particular offer, and incidentally, the offer was to join with my family, which was very important for me. By that time, I was married. I was having one kid. So I didn't want to, and of course, our son was also there. So 2 kids. So I didn't want to be separated from my family. And I agreed to that. And we shifted to Oman in January 1993. That's where a new chapter began, and all of us, we liked the country so much that initially we had thought that we'll be there for about 5 years or so, 5 to 7 years. We'll collect some kitty, come back and start my private practice, or maybe I would join some physiotherapy college, something like that. But the country kept us there for next 22 years. And we were extremely, all of us, we were happy. And that gave me another horizon to expand. This exposure was essential again because of I got international faculty to interact with. We had a lot of Arab students, and again, in those days, their level of English was not so good. So we had to have the first semester, which was mainly to upgrade their English speaking understanding skills. And then it was 3 years physiotherapy program. It was a diploma in those days. Later on, we had a collaboration with the Glasgow Caledonian University, for which I was the coordinator, and we upgraded that diploma program to the degree level, which is still being run now from 2014 onwards. Now, the work culture at Oman as well as India is slightly different. In Oman, generally the patients used to expect too much from the physiotherapist, and they were not willing to do much on their own. So you needed to inform them, you need to talk to them, you need to make them understand why physiotherapy is not a passive profession but an active profession. It took some time for the patients to understand what we were saying. Even the students, they were initially thinking that physiotherapy is a passive profession. It's only you fix the machines and that's the end of it. No, it is not like that. We had to re-emphasize it, that there is a lot of work involved on both the sides, because a physiotherapist can only show, physiotherapists can only teach, but ultimately it's the patient who has to carry out whatever has been told. So what I always say, that physiotherapist is always a teacher and has to be a good role model. The patient will follow, patient will observe you and do what you are doing. So if you are good in your work, if you are accurate in your work, automatically the patients also will get benefits out of it. Now, by the time, as I said earlier, slowly the physiotherapy profession was going away from modalities, and the concept of mobilizations, manipulations were being introduced. Now, from the time I have come back, I came back in April 2015. Till today, I have not used a single modality to treat my patient. Of course, I deal mainly the musculoskeletal conditions, and till today, I have not felt the need to use any modality. I always use my hands. I use manual therapy to treat my patient to get the desired results. Nowadays, what I have been doing is I am taking only challenging cases. Of course, for last 2.5 years, because of COVID-19, there were only telephonic consultations or video consultations, no actual contact with the patients. But I do like to take challenging cases, and I like to explain what I'm doing, what I expect from the patient, because I have realized over a period of time that if you invest in your patient, you and patient will reap lots of benefits. That is what is very, very important. You must explain to your patient what you are doing. Even though you may feel silly why I'm doing this, but no, patient will absorb. Patient will absorb, if not, but at least 50% of it, and you will see it in the results. So now I would like to conclude this by giving you some take-home messages. Number one is be confident, but not overconfident. If you are not confident in your action, your patients will realize it, and they will have little bit of hesitancy in what you are asking them to do. So be confident, but not overconfident. Overconfidence can lead you and your patient in a lot of difficulty. Second is keep updated with recent advances, but apply only what gives you the best results. There is no end to knowledge. There are lots of things to learn, but apply what is required at that moment for that particular person. There are many courses available. I have been seeing now that, and there are a lot of advertising, lot of marketing skills which go with these courses being conducted all over India. Make up your mind what you want to be in the field of physiotherapy. Do you want to be a general physiotherapist, or you want to get specialized in your field? Then zero it on those particular skills, master them, and become a specialist in those areas. Third point is patient safety first. It's most important that at any time the patient should not be at any risk. Make sure that when you are giving any exercises, doing any activities, if at all you are using any modalities, all safety precautions are taken. All safety checks are done. This is particularly important when you are ambulating the patients. Make sure that the area is free of any obstacles. You have enough control over the patient's movements. You have enough equipment to take control of the situation. Of course, your safety also comes following that. At no time you should harm yourself. If you think if you need to shift a patient from place A to place B, and if the patient is heavy or patient is heavily compromised, do ask for help. Don't try to do it yourself and get yourself injured with a slip disc or sprained shoulder or neck or low back. Fourth, always keep accurate records. Nowadays, this is most important from insurance point of view, medical insurance point of view, medical legal point of view. You must have your records written very crisp and clear. And if required, it should be in presentable form to the authorities. Number 5, I already mentioned to you, always communicate effectively with all those concerned. When I say all those concerns, means with your colleagues, with your patients, relatives, the doctors, and whoever is concerned. All of them should be made aware that what you are doing to your patient. Now, lastly, I would like to say that what my father had told me. My father had told me that, Vikas, you always be after Saraswati, the goddess of knowledge, and not after the goddess of wealth, which is Lakshmi. Because if you are after Saraswati, Lakshmi is bound to feel jealous and she will start automatically follow you. And that's what I did, and that's what I'm here today. Thank you very much. Last but not the least, I must mention Amreen and Hiranmayi, who showed a lot of perseverance in getting me here. We have been planning this for last 2 months or so, but something kept cropping up and it kept on getting postponed. But I'm happy here today that I am here. And in fact, I would like to see these two faces, Hiranmay and Amrit. Thank you very much for listening to me. I hope it helped you a lot. Thank you very much.
Thank you so much, sir. It was an honor to hear you. Thank you so much for coming and sharing your experience with us and being so humble throughout this whole journey. And yes, we will remember all of your 6 pointers and also the pointer that we should assess the patient from A to Z without missing any pointers. Thank you so much, sir. Now I will ask all my students to ask questions to sir if you have any.
Now, Amreen, I am not able to, I'm on my mobile, so I won't be able to identify who is there because I got only 8 windows open here. So you will have to help me out if somebody is asking anything.
Yes, sir. Yes, sir. Anyone from the students?
Ma'am, I would like to ask one question.
I have a question, sir.
Yes.
Palak, you ask first. Sir, this is Palak. She's a fourth-year student.
Okay, sure. Go ahead, Palak.
Firstly, it is a pleasure to have attended this session. So thank you so much for guiding us. And with such a rich career that you have for the last so many years. So my question was that you've experienced physiotherapy in both India and outside. So I wanted to know what is the main difference and how can we, because we are still in our final years, so, we want to think about how we can go forward with going abroad. So especially in Oman and, countries like these. So I just wanted to know what is the difference and, how was your perspective regarding that?
Okay. Palak, basically, physiotherapy, as I mentioned, remains same. But what is happening now is that over a period of time, the local governments in Gulf countries, they have realized that they also need to train their own population for becoming professionals. So they have stopped gradually accepting foreign graduates into their workforce. But what I'm talking about is in the government workforce, medical forces. But still, there is a lot of possibility of joining the private sector. There are a lot of private hospitals which have come up in Oman, all over the country, and there is a requirement of physiotherapists to support their system. Now, the reason is the students who graduate from the physiotherapy college in Oman, they generally tend to join the government sources, government hospitals. So there are not many who join in the private sector. Now, there is a little selfish motive behind it because what happens is government sector, the work hours are from 7:30 to 2:30, that's all. And after 2:30, you're free to mind your own business. But in private sector, the medical field works in 2 sessions, morning 9 to 1 and evening 4 to 7 or 4 to 8. So you get occupied throughout the day. So that is why the Gulf physiotherapy graduates are generally not very keen on joining the private sector. So that's where, Palak, there is a scope for private sector physiotherapy profession. The drawback of this is that there is a bit of salary difference or compensation difference between the government and private sector. So there you have to be very careful while reading the agreement which you sign to join a particular job. And if you have somebody in Oman already, not necessarily in the medical field, but in any field, if you can take help of that person in understanding the contents of the contract, it will be very good. So that's what I would like to emphasize as far as the employment in India and employment in Gulf countries is concerned. What I understand is still there is opportunity to join UAE, that is mainly in Dubai or Abu Dhabi. and maybe to Sharjah, if I understand correctly, and in Muscat and some cities of Oman like Sohar or Nizwa, where new hospitals have come up. So that's what I can tell you, Palak, at this moment. And of course, you have to appear for a written exam and an interview to ensure that you are competent enough to take up that position. That's it,
Right.
Palak. I can tell you.
Thank you. Thank you so much for your insights, sir.
Hello, sir. Hiranmay here.
Hiranmaya, nice to see you. Yeah, okay.
Yes, sir.
Do you have any question?
No, sir. You called out for me, so I'm here.
Yes, I wanted to see you. I heard your voice, but I wanted to see you. Yeah, thanks for that. Yeah. Any other question?
Hello, sir. Smara here from the internship batch.
This is Myra. She's from the internship batch. She wants to ask you a question.
Hello, sir. May I?
Yes.
So, firstly, we thank you for gracing us with your
Can
presence.
you be little louder, please?
Sure, sir. So, firstly, I would like to thank you for gracing us with your presence. You've answered so many questions our young minds would have. I had one. As you said that in your days, the initial ones, electrotherapy was trending. That was the go-to method. And that was followed by manipulations in the later years. Do you see a trend or a transition coming up with any new techniques in physiotherapy?
See, what I would say that after all, there will be innovations, there will be new things coming up. You must have seen as an intern, you must have been exposed to various flyers going around. You need to decide what area of physiotherapy you want to be. And based on that, you need to look at the innovations happening in your field. Now, as I maybe a person from a old school, old thoughts, as such, I would love to attend this courses or workshops, but I may not necessarily employ them or use them. But that will definitely give me an insight that there is something available there. So I'm sure there will be new skills, new techniques will be coming in, but it's up to us to evaluate them and see how useful they are for you. Now, why I'm saying so? Because when we were just passed out of the undergraduate program, laser therapy had come in a big way. And everybody was talking about laser. But over a period of time, what I have seen, what I experienced because I used it, I taught laser also in Oman. I did not see the big issue being created about laser. I didn't see that it gave such a quick results. It was marketed mainly for quick healing and things like that. I don't think it worked that way. See, nature is the best healer. Nobody can beat nature. Whatever you may try, you may assist the process, but healing will take by its own time. There is no way you can fast track it. No shortcut there. So that is my way of thoughts, maybe old thoughts, whatever. But this is what I would look at it. So you may find my answer a bit diplomatic, but this is how it is.
Thanks a lot.
Anyone else?
Hello, sir.
Sir, I would like to
Sir,
ask a
I am
question.
Vishnu Solanki.
My name is Vaidehi. Hello,
Yes.
sir. My name is Vaidehi. First of all, we are very glad to have you today.
and we thank you for your valuable words and knowledge. Sir, I would like to ask you a question. So, with an experience of over 44 years, you must have witnessed a lot of physiotherapists flourishing in their own fields. I would rather say a generation of physiotherapists flourishing in their respective fields. So, I would like to ask you, what changes have you noticed over the years of physiotherapists in terms of their approach towards the treatment and also in terms of their approach towards the patients?
Vaidhi, I am bit at a loss to explain what you are asking me, because from the time I come back, I am into my freelance physiotherapy practice. I have not been attached to any clinic or any hospital. So I am at a loss to answer your question because I have not seen them. But whatever interaction I had with the younger generation at various conferences, what I must say that all are enthusiastic, all are willing to absorb new knowledge, all are willing to discuss issues and come out with the required solutions for the patient. This is, but my exposure to them is only during the times of various conferences and workshops. But I have no experience of one-to-one uh, uh, contact with the physios of what you have asked me. So I'm sorry, I am not in a position to this. Maybe if I visit your institution and work with them for some time, I'll be able to answer at a later date.
Hello, sir. I am Drishti Solanki. I'm pursuing my master's in cardiovascular and respiratory physiotherapy.
Yes.
Sir, firstly, I would like to thank you for such a motivational session. It gave us a really good message that if you have passion and knowledge, it can lead to a great future ahead. You can be.
I'm not able to hear you.
Drishti, can you speak a little slowly and more clearly, please?
I got the first part, but the second part, there was no sound at all.
Okay. Hello.
Drishti, it is get your voice is
Hello.
It's breaking. Your voice is breaking.
Hello.
Can you ask
Hello,
now?
sir. Is it
ask.
clear now?
Yes.
Yes, sir. So it was a really motivational session, which gave us an important message to build. You can build your future on passion and knowledge. It is very important to have great passion and knowledge in your field. So, as you rightly said that earlier in your days, massage and electrotherapy were, and also exercise therapy was usually given. So, from cardiovascular thoracic department, what kind of patients exposure were there, and what was the protocol given to them at that particular time? Since I am pursuing in this field, I would like to know what were the past old days scenario.
Sure. Now, in cardiothoracic, CVTC, Cardiothoracic Center, as I mentioned earlier, there are two main departments. One was cardiothoracic surgery, and other one was chest medicine. So in cardiothoracic surgery, of course, we had to see the patients in ICU, in the recovery room, and in the general ward. Of course,
Sir, we can't hear you.
Sir, kindly unmute your mic. Yes.
now in chest medicine, generally the protocol was to assess the patient, auscultate, and see what is the level, the check the basic parameters, I'm sure you must be doing. And then later on, work out a program whether the patient will be satisfied enough with just breathing exercises, or you need to have some assisting devices. Like in those days, humidification was great help, especially for those who had thick secretions, who had not so strong expiratory effort or depressed cough reflexes. So humidification used to help to get back the what I can say, the remove the secretions, liquefy the secretions, and bring them out. And also we had the postural drainage positions, especially to help the bronchiectasis patients. So these were the protocol, and then we used to give them a home program. And now, especially for the clientele, what we used to get in the outpatient in KEM was from low socioeconomic group, and there was no possibility of having a postural drainage table at home and things like that. So we had to innovate ideas. And one of them you may find, all of you might find a bit funny, but what we used to tell them is to use their staircase or use a bed at home with multiple pillows and lie over them in prone position. So now lying on a staircase in a prone position is, I am sure it's not an easy proposition, especially for an elderly person, but young people who could do that, and that could help them to bring out the secretions, especially from the far off areas of the lungs. But for middle age or elderly people, will advise them to use 2 or 3 pillows at home and lie them over the prone position and try to bring out the secretion. Now, for that was in the initial stage, and the humidifier was mechanically operated. So it had a compressor which used to make a huge noise in the ward. But later on, there was ultrasonic nebulizer which was introduced, and that brought down the noise level, and it increased the efficacy of the treatment because it could break down the water molecules to tiny micron level, and that used to go quite deep inside the lungs and help in humidifying and bringing out the secretions. So that's what I would recollect what we used to do at those times. And of course, we used to do pulmonary rehabilitation. We had a static bicycle in those days, and we used to, and I believe there was a treadmill which was with the cardiac department. Yeah. So since I was mainly dealing with the cardiothoracic and chest medicine, this is what we could use. We could use a stationary bike, and there we used to take the parameters before and after the activity and guide the patient accordingly. Now, there was also a section of cardiac rehabilitation where the post myocardial infarction rehabilitation was carried out, but that was not my area. So I won't be able to comment on that.
Thank you, sir. Anyone else who wants to ask a question?
Sir, I would like to ask a question.
Mm-hmm.
Sir, I am Prerna Khosla. I'm currently pursuing my master's in sports physiotherapy. And first of all, I would like to thank you for this very inspirational session. My question would be rather political. Is there any cultural or political bias that we would face in a Gulf country being a Hindu in a Muslim country?
Not at all. Not at all. See, luckily, I worked in Kuwait. I worked in Oman. Both were Hindu tolerant countries. We had no issues. The only issue in Kuwait was we were not allowed to celebrate Hindu festivals in public, but you were free to celebrate it in your own premises, in your home, etc., etc. In Oman, you will be surprised to know that there are 2 Hindu temples, full-fledged Hindu temples. And we used to celebrate their Ganeshotsav, 5-day Ganeshotsav. We used to celebrate Navratri. I myself have played Dandiya and Garba there. And I mean, as long as you don't do it with much fanfare outside, and of course, you are not allowed to take out processions. No processions allowed for various reasons, not necessarily political, but from organization level, traffic management, etc., etc. At no time we felt any threat in both these countries. In both the places, my wife used to go out for shopping on her own with her friends, and no compulsion of wearing burqa at all. Of course, they expect the expatriate population to wear clothes as per the local culture and respect the sentiments of the locals. So if you stick to that, there is no reason why you should have any inkling in your mind. There's nothing there. Nothing there. Absolutely safe to be there.
Thank you, sir.
Of course, you should avoid certain areas which you will be told eventually if you happen to be there, and avoid being out at late nights for obvious reasons. That I believe in India also. We need to be careful about what we do late night. So same applies there as well.
Thank you, sir.
Right.
Thank you, sir. I think we can now conclude the session. Thank you so much, sir, for joining us and giving us your precious time. Thank you so much, sir.
Okay, right. So nice talking to you all and listening to the queries. And I'm looking forward to pay a visit to your institution anytime soon. So thanks a lot for calling me here, and stay safe, I would say. Thank you.
So we're looking forward to have you here.
Okay, right. Thank you.
Thank you everyone for joining.
Thank you, sir.